everyone. We're going to start in 1 minute. I'm just going to let everyone join who's still joining. Hi, Julie. How are you?
Hello. Yes, very well. Thank you, Eleanor. Yeah, you can see me all right, can you? Yeah.
Yeah, I can see you perfectly.
Good. Welcome
Brilliant.
to everybody joining. Yeah.
Okay, I'm going to make a start. Thank you everyone for joining today. This is number 4 in our series of Exploring Eczema webinars. So today we'll be looking at eczema triggers. Our lead speaker is Julie van Onselen. She's been with the National Eczema Society for over 20 years now. So here at the National Eczema Society, we work to provide information, advice and support for those living with eczema and their families. All the work we do is voluntary, so we will be launching our Christmas fundraising appeal this month. So if you go onto our website, you should be able to find that. So if you find today's session useful, we'd greatly appreciate anything that you could spare towards our course. You'll find lots of help and health information on our website. So if you go there after this session, you'll be able to find additional materials to what Julie has spoken about. So I'm going to introduce Julie now. Julie has worked with the NES for over 20 years supporting members of our eczema community with their eczema journeys, and she's also worked within the NHS supporting with eczema for over 30 years. So over to you, Julie.
Thank you very much for your kind introduction, Eleanor, and thank you very much to everybody for joining today. As we say, this is our 4th in our series, and we've been focusing on a different eczema topic to try and give you a bit more help and support and answer your questions. As we go along, you are very, very welcome to put your questions in the chat, and then we will hopefully have time to answer questions at the end of the webinar, which will finish promptly at 2 o'clock. So quite a lot to get through. It's an interesting topic, and there's quite a lot to say. So that is me, and as Ellen has already introduced me, and as I say, I also work very passionate about working for patient support groups and work for a few others as well. Very passionate about education and clinical work. So what are we going to cover? We're going to cover eczema triggers, and we're going to look at the complexity of eczema and the relationship with the immune system. And we're going to look at different types of triggers. So triggers may be irritants, they may be allergies. And then we'll specifically look a bit more in detail at food allergy and eczema, when it happens, when is it likely to happen, or when does it not happen, and symptoms of food allergy, and also a little bit about the allergy testing that really is available through NHS or through consultant allergists or dermatologists. So there's lots of questions about triggers. And I think the first thing I always say is that eczema is an incredibly individual condition. What may be a trigger for one person may be absolutely fine for someone else. So there are principles, and there are some things that obviously are triggers for everybody, but may not be an allergy, but may be an irritant. So soap is a good example. There may even be some universal allergies. So for instance, house dust mites. But generally, it's just a question of you getting to know your own eczema. And I think that leads to the first question, because people often say, when I meet them in clinic or when I've been speaking to people with eczema through the Eczema Society, a lot of people really want to seek, what is the actual cause of my eczema? Why have I got eczema? What are the triggers? What are the allergies? And if I took them away, would my eczema go away? Sadly, not always, because eczema is a long-term condition, but there are some types of triggers or allergies that may be a contact allergy, and actually discovering that can make things better. So the cause of eczema is complex. We'll talk about that, and we'll talk about what an actual trigger is. And it's really, really important, I think, to look at the difference between an irritant and allergy, and we'll look at a few different scenarios for that. So how can you actually avoid exposure to triggers? So lots of really good practical advice about how to avoid triggers in the home, the garden, work, school, etc. And when should you have allergy testing? When is it actually relevant? So I think the first thing to say is eczema is complicated. There really isn't any one cause, and the only causes we can really put eczema down to is genetic causes and also atopy. So atopy is a genetic cause. It's the gene that carries asthma, eczema, and hay fever. So if you, as a parent, for instance, had hay fever, even if it was quite mild, you have a 25% chance of your child developing atopy. So this may mean they may develop eczema, and this may also be your story. And you may have not had any experience of eczema. So where does it come from? Well, it does relate to this same gene. Some people can have one atopic condition, and other people can have two, and other people can have all three. So, atopy runs in all families. It runs in my family as well. And then other genetics that relate to atopic eczema in particular is the filaggrin mutation. We'll look at this in a minute. And this is when there is a protease within the skin that is mutated, and it has a way of actually altering the skin barrier. So with some other slides, we'll look at this. So it basically means that the skin barrier is not robust. It's more likely to let in allergens and irritants and let out water. And this is one reason for eczema continuing. We think about 50% of people with eczema have filaggrin mutation. Also, early onset allergies already present and high Ig levels, if allergy tests have been done, these can all lead to really a prediction that eczema may well continue into the adult years. And of course, combined with all of that is your overactive immune response. And this is why eczema is complicated. It is a complicated diagram, and it does come from a medical textbook. And I think that's why it's really important to share it with you, because actually it's not about just taking away one thing that may be triggering the eczema. There is so much going on. And this is indeed why now we've got so much development of drugs that actually alter and block immune pathways. So, for instance, there's a lot of T cell activity in eczema, and that's what drives the inflammation of eczema. So a lot of the new biologic drugs will actually break pathways here, and in that way, they will actually alter the course of the immunity of eczema. You've also got a trigger with reduced antimicrobial defense. So that means that within the skin microbiome, there's a lot more Staphylococcus aureus, a bacteria that will drive eczema and cause infections. I've already talked about the genetically imperfect barrier, which means that, water can easily be lost out of the skin, which causes dryness, and in turn allergens and irritants can penetrate in to then go and also excite the immune system and cause that redness and inflammation. And itch is also driven by inflammatory markers. Your IL-31 drives itch here. It's interesting that unless you have urticaria, histamine plays a very minor role in the itch of eczema. So as I say, it's a complicated condition, and in that way there can't be one single cause. So triggers very practically can run from lots of things that are normally in a home or a garden or an environment. So in that way, they can be quite difficult to reduce. So soap and detergent is a key trigger for anyone with eczema. This relates back to the filaggrin deficit, because actually if you use soaps and detergents on your skin, you increase the pH of the skin to a pH of 8. In turn, a high pH will break down the skin barrier even further. And when you have a filaggrin deficit, you have a more tendency to develop your skin to have a higher pH. So actually the best way to reduce the pH is to use your emollients to wash with and as a soap substitute, and also to apply lots of emollients, and that can bring your skin pH down. Obviously, there are lots of environmental effects, hot and cold weather. Some people find that hot weather is more problematic than cold. We're going to go through each of these in turn, actually, in more detail. So again, at the moment the weather's getting colder, the heating's going on, humidity's down. Pollens and molds, pollens in the spring, molds in the autumn. What else do you put on your skin? It's really hard sometimes to find makeup or other skincare products that are kind to your skin, but sometimes they can cause irritation as well. I always say try and keep your skincare regime fairly simple. Smoke, we do know that cigarette smoke and other pollutants, some eczemas has a sort of slightly higher prevalence, people who live in urban areas, but we also know smoking in a household can be detrimental to your child's eczema. And we don't know enough about vaping, but I would imagine this could follow as well. House dust mites are very prevalent in carpets or furnishing in beds, and of course pets. Now, I would never ever say rehome a pet unless you're absolutely sure it's an absolute allergy, because actually a lot of children with eczema derive so much benefit from pets, and actually sometimes having a pet can make you less susceptible to being allergic to a pet as well. Food preparation as well as eating, fabrics, beddings, and stress. So there are so many triggers, and I think the key point, as I said earlier, is this individuality. So we're talking about irritants and allergies, and it's really, really important to understand when is something irritating, and an irritant dermatitis, and dermatitis, of course, means redness and irritation of the skin. Other toxic effects of your skin being exposed and overexposed. We call it an insult exposure, and that can affect everybody. Now, I'm sure even people listening who don't have eczema, because they may be parents or carers, everybody remembers we nearly all got irritant hand dermatitis in COVID when we started to wash our hands a lot more and use a lot more hand gel. Probably 100% worse for people with eczema, and we all had to cope with that. So, an irritant dermatitis is often a transient, it's not an allergy, but you can see this by overusing, wet water, household cleaners, cement for someone like builders, acids, oils, solvents without protecting our hands. And of course, for people with eczema, that would often be a whole lot worse and could even trigger eczema. Whereas if you have an allergic dermatitis, or we call it allergic contact dermatitis because it is a content, it is an eczematous reaction caused by immunological response following exposure to something that you as a human have previously been sensitized to. So things like nickel, this is a clear example of a nickel allergy with the belt, a nice picture there. This gentleman probably has been happily wearing his belt, maybe for a few weeks or months, and suddenly he's had an immunological reaction, which means that with this repeated sort of exposure to an allergy, suddenly there's a kind of change, and whoosh, an allergic reaction occurs. So this can happen with lots of things, allergic contact dermatitis, and this is the main reason why you would be referred to a dermatologist for patch testing. Now, contact allergic dermatitis is much more likely to happen for the first time in the teenage years, young adulthood, and we do know that if you have atopic eczema, you have an increased risk of a contact allergic dermatitis. So I talked about some of the environmental triggers, and here when we see seasons of the year, we can see that in the spring, pollen and high pollen counts, particularly tree pollen, can be a real enemy to eczema around the eyes. So sometimes, you may have to take different protective measures, or it may be the time of the year where that's when you're having to treat the eczema around your eyes more than other times. In the summer, heat and perspiration. So getting overheated, we know, is an enemy to eczema, and perspiration in itself can irritate the skin. In autumn, there are a lot more molds and fungi around with that time of the year, more sort of damp environments. and in winter wind chills and colds, and also the central heating going on and humidity reducing. So you might find a pattern to your eczema that you actually you cope okay in the autumn, but you don't cope in the spring. So maybe pollen is more of a trigger for you. Conversely, you might find it really hard when the heating goes on and the weather gets cold, whereas in the summer, you cope well with your eczema. So your environmental trigger is important to try and discover. So we also say that, allergy tests do give us clues and are important, but actually, if everybody universally was tested, everybody with eczema would have the high IgE levels, and the IgE is the immunoglobulin levels that would actually give you the indication that you have a true allergy. But actually, if every person was tested, everybody would be positive. I always say to two things: one thing outside the house that you can't avoid, pollen, and one thing inside the house that you can't avoid, house dust mite. So we'll talk about house dust mite in another slide. But with pollen, grass, weed, and tree problem are more problematic in the spring and summer, again, as I've said. So there are some, tips, try and keep windows and doors closed when the pollen's high, because the pollen will come into the house, particularly in your bedroom. And I think that's really important. Certainly, obviously, a beautiful sunny day, it seems like the best thing to do if you wash your clothes is to hang them on a washing line, because they will dry naturally in the sun. The problem is that when the pollen is high, the pollen stores will actually stick to them. So you're better to continue drying in the house or tumble dry, which I know can be a problem because it's expensive now. But the problem is that with clothes, it's often what is left on the clothes, or what comes and joins the clean clothes, like the pollen, rather than actually the washing. So it's the drying that can be more problematic to add triggers to something for your eczema. So central heating and humidity. So central heating reduces humidity, and when atmospheres are less humid, your skin will be dry, and when your skin gets dry, it itches. But if you use too much humidity, people sometimes say, bowls of water on the radiator or buy a humidifier. You have to be really careful, because high levels of humidity can actually encourage house dust mites, and can increase the population, and it can grow mold. So the idea is to try and keep your home cool at a regular sort of 18 Celsius degree, and turn radiators off at night. So try and have heating off at night, because a cool bedroom is one of the best ways to help sleep as well. Keep the home well ventilated all year round, but as I say, don't open your windows when the pollen's high, and try and, if you can, maintain that humidity level. And as I say, we would never encourage anyone to buy a humidifier, and we have to get the balance. But if you felt it might make a difference to you because you were the person whose eczema got better when the winter months come, it may be a consideration. So soaps and bubble baths, unfortunately, will always harm the skin. And so you really need to stick to your products recommended by your healthcare professional, and always use your emollients for washing and then for moisturizing. It's really tough, isn't it? Because a lot of children will really want a bubble bath. I think really the thing is, I sometimes say bubbles are fun, but they're not necessary. They're only going to cause more harm to eczema. So maybe introducing different play in the bath, different bath toys. So bubbles are just not a thing in your household. I do think it gets much harder, though, when children become teenagers. And I know at the moment there's a real high trend for or teenagers, or as I like to call them, tweenagers, the younger girls, sort of 10, 11, 12, for having sort of pampering parties and bubble baths and making bath bombs. So it can be quite difficult at that age range. The problem is that any detergent which soap and bubble bath contain will raise the skin pH to these acidic levels that will damage the skin barrier. So that's why emollients will keep the skin pH at the ultimate 5.5. So as I say, the bottom line is to really avoid soap, cosmetic washes and bubble baths. So laundry, I always find it quite interesting that laundry and washing often causes people a lot of worry. And trying to, we often on the helpline have people saying, oh, I can't find a good washing powder because all washing powders tend to irritate. And there has been a sort of conventional thing that maybe non-biological are better than biological powders, and liquid is certainly better than powder. I think the key principle is now that a lot of this evidence about washing powders, irritating the clothes was because sometimes residue wasn't washed out, particularly when people were hand washing. This was pre-hand washing cycles on machines or using other sort of ways to wash clothes. So I would say that modern washing machines, and quite a lot of them have double rinse cycles, which can be very useful as well. They generally do remove all the washing residue from clothes. And I think that's quite important. It's also quite important to use quite high temperature washes as well, because that will reduce house dust mite. So obviously, when you have a child with eczema or you have eczema yourself, you want your clothes to be soft, and normally people like fabric conditioners. Unfortunately, fabric conditioners are generally perfumed and they leave the residue in the clothes. So the fabric conditioner is much more likely to be the problem than the washing detergent. And also, they should be avoided. So unfortunately, again, tumble drying to promote softness is probably the best way to do it. Sometimes you can get these washing balls as well. So there are things you can use. Buy eczema friendly clothes, natural fibers, cotton. Make sure, there's a very rough material here and a rough seam. So we want to try and have flat seams. Also, just remove labels from clothes. Even sort of a long scratchy label can be an irritant in itself. So house dust mites, it is impossible to get rid of house dust mites, and you need to reduce the contact. Because every house will have house dust mites. Now, I absolutely would never recommend anybody to rip out their carpets and have vinyl or wooden floors. Of course, that will be a little bit more helpful, but I think unless you have a very severely allergic child or someone with severe eczema, because vacuuming your carpets and soft furniture several times a week should be enough. So wash, dry clean, or steam. Get a steamer. Steamers are really good to eradicate house dust mites. But again, you don't need to buy this to clean cushions and curtains. Very simply, just damp dust rather than wet dust. Dry dust. Dry dusting will spread the dust around and keep your house decluttered. Soft toys, wash at 60 degrees or put in the freezer, and tumble dried clothes on a hotter setting. Again, appreciating this is expensive now. I think one of the best things you can do actually for your child, particularly if your child with eczema or even you as an adult is sleeping on relatively old mattresses or pillows or duvet, is if you do have the funds that allow and as they say, a lot of people say they want to pay for allergy tests. I'll say, perhaps it'd be better to replace old mattresses, refresh your bedding with washable bedding, and actually use anti-dust mite covers. And that can make a really good difference. So, reduce humidity again and air bedroom daily and get this humidity balance again. So pets, animal dander is skin cells, saliva and fur can all be irritating, and some people are allergic to their pets, but absolutely not everyone. And pets are also very therapeutic. I think sort of try and avoid too much stroking and actually cuddling your pets, which is really hard because some pets are very cuddly, aren't they? And train your pet to try and use their own pet basket and do ban them from sofas and chairs. Do keep pets out the bedroom. I think that should be a bit of a golden rule because that's the one area that we want to keep as allergy free as possible. Brushing will help remove loose fur, and also things like pollen can stick to pet fur as well. And if eczema is not controlled and being near to your pet causes more intense itching, it may be an idea to have an allergy test to see whether there is any allergy to pets or not. And as I say, for some people, this can be an allergy, and then, hard decisions have to be made. But for a lot of people, pets is not necessarily an allergy as such. So there are some cosmetic triggers, so hair dye, PPD, phenylidamide in permanent hair dye. So sometimes this can be as problematic as well for the hairdressers who can get really bad hand dermatitis, but also for the person if their hair dye. This can be another allergic contact. So you may have had your hair dye, a few times, and then suddenly you go and have your hair dyed a new color, and then suddenly whoosh, it develops, and you can get very sort of sore red facial eczema from hair dye. That also is also seen in henna as well, and henna sometimes are also used in tattoos, and tattoo inks. A lot of people with eczema, or some people with eczema, might feel a tattoo might be something because it might take people's vision off eczema, but actually sometimes a tattoo can make your eczema a lot worse. And there is a very rare contact allergy with red ink, so red ink contact dermatitis, which can be really, really nasty and really sore. So I suppose the advice is avoid red ink in your tattoos if you have eczema. Nails, this is an emerging and growing allergy, an acrylic allergy to gel nails, to the glue as well, and nail varnish as well. Often nail allergy can erupt the face, and often it's sort of, touching your face or drying your nails. And allergic reactions can cause more sort of severe symptoms with nail distortions, fingernails loosening and splitting off, nail splits actually, and as I say, you often see allergy from nails appearing on the face. So let's talk about food allergy now. So an instant reaction to foods is probably not always a food allergy. Now, you can certainly get an instant reaction to food, which can be an IG allergy. But certainly, I think these two children just show that there is a lot of food around the mouth, and a lot of foods will cause just a general irritation. So citrus fruit, ketchup, strawberries, onions, and things. And infants, of course, are messy eaters. So I think if you just have a bit of redness around the mouth through eating very irritate food, it's more likely to be an irritation and not a food allergy. But if there is actually a whole sort of reddening of the eczema, maybe any lip swelling, we'll come to that in a minute, then that could be a food allergy. So I think just remember that irritation is there as well as allergy. And because infants are messy eaters, a good way to sort of check that is to use an emollient as a barrier around the mouth and prior to meals. So, just apply your emollient as a barrier, and then after the infant has eaten, just avoid wet wipes at all costs because they can cause more irritants in themselves, and remove the food residue with a damp cotton pad and emollient, so a damp pad that has emollient on it. And if you're an adult and you have eczema and your hands are affected, particularly try and wear protective gloves when handling your food, because the irritant reaction also can be seen in hands. So the facts are really that there's at the moment there's no evidence for changing maternal diet or supplementation to prevent eczema in the pregnant lady. So there's no evidence for those changes in pregnancy. Even with breastfeeding, it's not known if altering the mother's diet reduces eczema severity. If a child does have a food allergy and food allergy is suspected, the mother may be asked to do a short trial of allergen-specific exclusion diet. But actually, it's very rare that a food allergy is actually passed on to a baby through breast milk. It's more likely to occur when weaning occurs. And actually, food allergy can actually be passed on through the skin. So adults who have foodstuffs on their hands, sometimes that can build up a sensitivity. So that's another very good tip for washing hands before applying your emollient to your child. So food allergy is most common under 2, and most common food allergy is milk, cow's milk protein, I should say, which is, often general formula milks are based on cow's milk protein, wheat, dairy, and there are other foodstuffs as well. But the main thing is that they will have reacted with quite immediate symptoms. So they will, eat something, suddenly flush red, feel a bit uncomfortable, maybe have itchy lips, hopefully no swelling, but we would worry about that. And it's also for children whose eczema hasn't been controlled by optimum management, because, as you say, you can get general eczema flares. The best thing really to do is keep a diary for a few weeks, and with pictures, maybe trying to take pictures of any immediate reaction. That really is the best way to sort of tell what might be happening. Food allergy can affect anyone as well. So cow's milk protein allergy is about 2% of children, babies and children. And children with eczema have a slightly higher chance or risk of developing food allergy than a child without eczema. And it's rare for adults to develop new food allergies, adults who have atopic eczema. Like anything, it can happen, but generally, food allergy development in adults is very rare. So I think peanut allergy and prevention is really, really important because we've had a change in guidelines now. So we used to say avoid peanuts in children and babies up to the age of 3, and that's completely changed now with some very important research work that was done at St. John's Institute of Dermatology. So now what we say is that if you early introduce peanut into an infant's diet, this does reduce the risk of developing a peanut allergy in high-risk infants, especially those with severe eczema. So a small taste of smooth peanut butter from 6 months is now recommended. So you would just have probably not as much as that actually, but just a little tiny bit, and you would give infants a taste when alongside weaning. And parents with can pass allergies from their hands from cooking, and they might expose infants to greater contacts of allergens when applying emollient. So again, it's really important for parents to wash hands before applying emollient because they may inadvertently pass on some of those food allergens. So the top 14 food allergies, which is defined by European law. So we talked about milk, eggs, cereal containing gluten, crustaceans, fish, mollusks, mustard, lupin, peanuts, sesame, soya, sulfates, and tree nuts. So eight of those foods cause most of the 90% allergic food reactions. And a food intolerance, which means that, someone is intolerant to glucose or lactose, is not actually allergy, that's intolerance, and that's separate. And again, it's something that, can affect anyone. And then in that way, if you have a food allergy, it's 2 main types, the IgE mediate, which is the immediate reaction, and the non-IgE mediated, which is harder because it's a sort of with a diary, you're seeing a pattern to eczema not responding as opposed to food. Children in particular may have other symptoms. They may have diarrhea, smelly nappies, etc. So food allergy is, it's a big topic. So with the IgE, where you have an immediate reaction, they appear immediately or up to 2 hours. And with non-IgE, you're seeing that over 2 days. So you're looking for these symptoms related to food: itchy rashes, wheals, which we call hives, facial swelling, running nose, itch, swollen eyelids, vomiting, tummy pain, diarrhea, and smelly nappies, which more relates to the non-IgE, whereas the IgE is more the immediate sort of hive-like response. So obviously, if your child or if you or anyone in your household has a severe allergic reaction, the first aid and the swift action is incredibly important. So 999, it's an emergency. You need to administer adrenaline. It might be that your child or you have a severe food allergy and you have your EpiPen that you always need to keep with you. So severe symptoms of anaphylaxis include airway issues with swollen tongue, hoarse voice, difficulty talking, breathing difficulties, circulation, pale, drowsy, fainting, collapse. So it's just good to know the first aid. And, with anything that happens with an allergic reaction, you need to be prepared as anybody would be, or if it's something that happens in the street or with a neighbour, to know what to do. And of course, then people ask about when you do test for allergies, because we talked about looking for symptoms, keeping food diaries. We've talked about, whether there's a contact allergy. So the contact allergy patch testing is the allergy test. It involves placing a drop of suspected allergen in a chamber, which is often placed in paraffin, so in white soft paraffin, and then the patches are just put on the back and they're marked on the back where they are. After 2 days, 48 hours, the patches are removed and you can see redness and whealing. And this is quite a lot of reaction on this person's back. So basically we have sort of what we call batteries. So you may have 30 ones, 1 to 10, 11 to 20, 21 to 30, maybe what we call the routine battery. For some reason they're called batteries, maybe because they look like little batteries, but the routine. And these are the top 30 most common allergens that dermatologists have discovered in the last year in Europe and the UK. And then, if someone's a chef or a hairdresser, you might have a hairdressing battery of common allergies found in hairdressing, chefs, common allergy found in cooking oils, builders, common allergies found on the building site, etc. Now, you can actually also bring in some of your own skincare products, things you use regularly or things you use for household cleaning, and you can have those applied to your back as well for testing. So again, it should be an individual test. You need to be referred to a contact dermatologist, and actually the wait can be quite long at the moment, up to a year in a lot of places. So specific allergy is found out by skin prick testing, and that's when you place a drop of suspected allergen onto the skin. So you just do a little scratch and you place suspected allergens, so things like peanuts and pollens and house dust mite, and then you get more of an immediate reaction. And then we also do blood tests for specific allergy as well, where we're looking for specific IgE levels and measuring levels, which can sometimes be done in response to allergen being applied to the skin. So all these allergy tests are quite complicated. They are specific to find the allergy, and they're generally done by consultant dermatologists or consultant contact dermatology specialists or allergists. Now, the problem is there's quite a lot of what I would call high street allergy tests out there. So don't send away some snippings of your hair, because hair is actually dead cells, and actually hair is only actually used to detect illegal drugs. So you don't get anything from hair in terms of food allergy. And I think just be quite suspicious of people who want to give quite comprehensive and almost then give you a list, particularly food allergy, and say, well, that's it, you're allergic to nearly every food that's going. And that can be very demoralizing. And the NHS would say that those sort of multi-tests that you pay for on the high street are not seeped in any medical evidence. So we come to the end. So quite a lot of information in this one. And also, I think, the theme for me is always, whether it's you or your child, that we really do need to keep everything very individual, because what one person is affected by and what triggers eczema for one person may not trigger it for other people. So back to Eleanor now, and I'll stop sharing because we were going to just have some time for questions. So hopefully some questions may have come about.
Yep.
Yeah,
Thank you, Julie. That was
lovely.
incredibly informative and hopefully useful for everyone dealing with eczema triggers out there. We're going to start off with a question from Peter, who's saying, just off the back of what you were talking about there, Julie, are you saying that if I developed eczema at 68, then it's unlikely to be an allergy, or just that it's unlikely to be inherited?
Oh, that's interesting. Yes. Well, first of all, Peter, I'm sorry you've developed eczema at 68. Um, I suppose it's very difficult with this one because, I don't know you, I can't see you, I don't know your history, and it depends where your eczema is. If it's more sort of all over eczema, and hopefully you've had a diagnosis from your healthcare professional, it may just be eczema. Unfortunately, there is a type of sort of what physiological eczema that can develop over the age of 60 because the skin barrier I was talking about can actually become more and more defective over the age of 60. Um, if it's sort of more specific in areas, it may be worth talking to your GP about patch testing. It's probably least likely to be food allergy. So as I say, it depends on history or how it developed, or was there anything specific at the time of it developed. Um, and if it's not genetic, it's quite tricky. A lot of eczema does have a genetic basis, even though it might have gone back, a generation or two. So I think it depends where it is. And if it is more Pacific areas or if it's very much hands or face, I do think it is worth asking for a referral to dermatology, and then, patch testing could be considered. But it may be generalized eczema, and it may be managing the eczema, and again getting the right support from your healthcare professional, or maybe if it is severe for you, asking to be referred as well, generally for eczema, for a general eczema assessment.
Thank you, Julie. So we've got a question from Claire who said, would you advise giving antihistamine before visiting a house that has pets if you know you're sensitive to pets?
Yeah, I mean that's not a bad idea actually. I mean antihistamine will help. An allergic reaction can be triggered by histamine, and basically eczema itself isn't triggered by histamine. It has a very muted pathway, but urticaria, which is hives and an allergic response. So I think if you've visited the house before and they have pets, and as soon as you walk in the door you feel itchy or you develop hives, or wheals on the skin, that is more of an urticaria response. So if you are finding you're having that response, it probably is quite a good idea to take antihistamines, perhaps before, but certainly afterwards, being in the house. So as I say, antihistamines do have a role, but more for urticaria and maybe allergic reactions.
Brilliant, thank you for that. We have a question from Andrew who says, thank you so much, Julie. I found all of these webinars so helpful to better understand my eczema. I'm 36 and still haven't really worked out my triggers, but I think stress could be a key one. Do you have any tips to reduce stress, or at least reduce the chemical effects it has on the body? Thanks.
Yes, no, thanks, Andrew. I possibly should have included a slide on stress. And you're absolutely right. Stress is definitely a trigger for eczema, for other chronic inflammatory skin diseases. The problem is that stress is completely individual, and some people cope quite well with stress. I mean, sometimes a bit of stress can sometimes even be positive. But if there is a lot of stress, what stress will do is it may stimulate obviously a lot of worry, but then that sort of worry can have physical effects, and it may even increase the itching of the skin. And then you can get another vicious cycle of sort of stress and itching as well. So it's really, really difficult because it is individual. I think stress avoidance is important for everybody, really. But for people with eczema, it would be a good thing to maybe look at other stress avoidance you could do. I think for some people, mindfulness can be very helpful. Certainly, learning relaxation techniques. If you are scratching in response to stress, and we talked about this in an earlier webinar, you could consider habit reversal as well. And I think, good stress relievers, whether whether you are physically able to do things or not, is also exercise. So making sure you are getting, particularly if you're working hard from home day in day out, just trying to get out and have some fresh air and a walk every day is really important. So simple ways of relieving stress, but I agree, stress can be a big trigger in itself, and it's just trying to unravel, well, what is the stress in your life, and then trying to find solutions that might help you with that.
Thank you, Julie. Got a question here that says, I find that a bad night's sleep can aggravate eczema. Is this common?
Oh, yes, absolutely. I mean, I think you're absolutely right. Sleep is so restorative. And if you're not sleeping well, and also if you're not sleeping well for a period of time, or your child isn't, sleep deprivation can actually occur quite quickly. So absolutely, I think anything you can to make that bedroom a very comfortable environment. As I say, keeping the bedroom temperature down low, looking at your bedding, looking at how you wash your bedding, washable pillows, duvets, trying to get into a routine with your skincare. We haven't talked about this webinar, but I really believe firmly in a good bedtime routine for anybody with eczema. So I would, try and have a short, tepid emollient bath before you go to bed. That can really soothe the skin. If you are treating your eczema, which runs on to the next webinar, which is going to be managing flares, you're much better to use your topical steroid once a day in the evening before you go to bed. So I think if you're not sleeping, often eczema is active, and if eczema is active, is eczema being adequately treated as well, or is your eczema in the control it should be? So yes, I mean, I think you're absolutely right. And if really you're finding it hard to sleep and you need help with restoring the sleep patterns, this is another way that actually a sedating antihistamine can be quite helpful. Antihistamines actually are very safe drugs. So and often in dermatology, they're almost given at sort of double, even triple doses for things like urticaria. So you could ask for some sedating antihistamines. So you could try those as well to help restore sleep. But I'm sorry to hear that, and I think sleep is pretty key.
That's great, Julie. Thank you. Another question. Can stopping steroids too soon trigger eczema, or can it be withdrawal that is triggering the red rash?
Yes, I mean, we're going to talk about this in the next webinar. I think, again, it depends on you individually. It depends on your eczema. It depends on the steroid you use. So this can be very, very individual. I always say that steroids are good to treat eczema for short-term flares, and you can only go wrong with steroids if you use too much, too strong, too long. And we do know that if there is any sort of topical steroid withdrawal, it's much likely people who have used steroids too much, too strong, too long. We haven't actually got any medical diagnostic markers, but we do have diagnostic markers for eczema and severe eczema. And again, I think often if you treat eczema for a short time and it comes back, sometimes people perhaps perceive that it's the steroid not working or bouncing the eczema back, but often it means the eczema perhaps hasn't been adequately treated, and actually it's not the steroid, it's the eczema. Again, we're going to go this in detail. So depending on your individual situation, it is important to use the steroids in the right amounts for the right amount of time safely, and the right amount of using steroids depends on your frequency, duration, and severity. And the steroids match the area of the body, but then also try and treat the eczema in the short term, but then have a lot more time afterwards for just using emollients only, as I say. And if your eczema really isn't being controlled and it's bouncing back, it is very possible that you might have more severe eczema and you do need advanced therapy and you need to be referred to a dermatologist, because actually, eczema can get to a point where the topical steroids are just not strong enough to control it. You see this in asthma, you see this in arthritis, you see this in inflammatory bowel disease. So, with most chronic inflammatory conditions, there often is, a stepped approach to treatment, and sometimes with more severe eczema, you do need to try and get that referral and that advice from dermatology. But as I say, it's a really good question. It is incredibly individual, and not only individual, it does depend on the strength of steroids you've used and how you've used it as well. And as you say, if you only use steroid for a day or two and you stop using it, the eczema will come back. And that absolutely will be the eczema, not the steroid. So we will be talking about this in the next webinar. And it's just sort of some principles, to just discuss really.
As a follow-up from that, Julie, when you say too much, too long, how long is too long by days? We've had that question.
Yeah, too much, too strong, too long is really about using too much. So using stronger strengths than perhaps you should do. You would never use, for instance, a potent steroid for your face, but you might use it for your body. Too long would mean actually using your steroid day in, day out for weeks. So, maybe using it, for say 4 to 8, well, for 4 weeks, actually, sometimes you do need to use that for hands and feet, but more than 4 weeks continual use. We generally would say use steroids for 2 weeks. The other really important thing is steroids should actually only be used once a day. So if you have been told to use them twice a day, or you're using them twice a day, we do know a study showed that once daily steroid was as effective as twice a day. So that's a really good way in which you can maybe reduce what you're using. But then on the other hand, if you don't use enough and you use a very small amount and you spread it all over your body in tiny amounts, you won't actually treat the eczema. So you do need to look at the fingertip units. But we generally say, as a general rule, and this may alter depending on your healthcare professionals, to generally use steroids for a flare, matching the potency to your age, area of body, for 2 weeks, once a day for a week, every other day for a week. You may move on to weekend therapy, which is absolutely fine, for up to 8 weeks, and that would only be using it twice a week for 8 weeks. Or also, there are alternatives to control steroids flares in the subacute or less fiery times, and that's your topical calcineurin inhibitors. So topical treatments such as Elidel or Protopic. But as I say, we will be going, this is sort of a real prelim, isn't it, to the next webinar. And we will have lots of discussion about steroids and how to use steroids safely, because actually steroids can be used safely.
Thanks, Julie. That was incredibly informative. I've got quite a long question here, so bear with me, but it's about peanut allergy in a 9-month-old. My son is 9 months old and has recently started developing eczema, probably since weaning. We use the emollient in his bath every day, which really helps, but after tracking his food, I think he may have a mild peanut allergy. His cheeks will flare up many hours after having peanut butter on toast for breakfast. I don't think the NHS would investigate further as it's quite mild, so should I stop giving him peanut butter or still continue to give him some? I've stopped recently, but not sure if that's the best route going forward.
Yeah, I mean, again, it's a really, really good question. Generally, peanut allergy is actually quite a severe allergy if it happens. So it's not really a grumbling red sheet kind of allergy. It's normally what we would call and that's why actual peanut allergy. If people become allergic to peanuts, can be quite dangerous because you need an EpiPen, because what you're going to do is get more of a severe anaphylaxis where there is an explosion of the eczema, there's swelling lips, there's wheezing. So I think the red cheeks after eating peanuts is kind of it's difficult to know if that would be connected to peanuts per se, and possibly unlikely. So it is quite difficult. I mean, obviously 9 months. Very obvious question is your baby teething? Because actually that might be the reason, but I'm sure it's not, because that's why you asked the question. Um, I think it's quite tricky. I mean, if you really do feel that food allergy is something that, because as you say, you can get these delayed reactions as well, and you really feel that food is a driving force, I think keep a diary with other foods, and see your healthcare professional. I'll ask for a referral to dermatology, if possible, a pediatric dermatologist or allergist, to have it explored further. But as I say, any food allergy can vary, but generally, if it's a true peanut allergy, it will be a severe reaction. So that again, I think probably best to sort of discuss a bit more with your GP.
Brilliant. That's great, Julie. I think that brings us to the end there. Thank you everyone for joining. And thank you to Julie for such an informative session. Managing eczema can be incredibly difficult at times, but we hope we've been able to provide you with some useful information and guidance. We have a number of downloadable fact sheets on triggers on our website. I've shared a link to a couple of them already in the Q&A, but we have many other topics and on our website at eczema.org to support you through your eczema management. Today's session was recorded, but not to worry, all of your cameras and microphones are off and muted. You'll be able to watch back on our YouTube channel or on our website after this session. Wanted to let you know we are featuring some more topics throughout our Exploring Eczema webinar series, as mentioned by Julie. The next one will be on managing eczema flare-ups and skin infections. These will be on Monday the 13th of January and Thursday the 16th of January. Registration is live on our website now, so you can head to our webinar page. You'll find information on how to register there and about other topics. You'll also be able to find our watchback sessions for any you may have previously missed. But thank you again for joining, and we look forward to hosting you next time. Thanks, Julie.
Thank you, everybody, and thanks for your great questions. They really were fabulous. Hope to see you next time.
Bye.